What's up, Guru Nation? Welcome back to theclinicaltrialsguru.com. Quick video today as I'm walking into a business meeting. It's the fundamentals of opening your own research clinic, right? There's nothing, people always try to make things overly complicated. Well, Dan, if I open a clinical research site, what CTMS system do I use? Are you kidding me? That's not what you need to be focused on right now. What you need to be focused on are the fundamentals, the blocking and the tackling, basic fundamentals for opening up your own research clinic, which is get a PI, get a study, and then get patients enrolled in that study. It's as simple as that. And then each of those three activities that I mentioned have their own fundamentals. So to get a PI, you knock on doors, you call, you ask your sphere of influence to refer you their colleagues. To get patients, you do the same thing. You network with people, you go out in the community. There's nothing complicated, there's no systems here. And yeah, you can start adding in some systems like CRMs, like I use HubSpot. There's a lot of free ones out there for following up, because following up, it's more than just something that sounds cool, right? It's actually one of the fundamentals. It's like blocking and tackling in football. So following up is very underrated when it comes to everything, especially biz dev, getting doctors for your clinic, getting patients for your studies. It's cold calling, it's door knocking, it's following up. Then you can worry about all those other things later. And yes, many people will say I'm oversimplifying things, but if you really think about it, I'm not, because you can actually convince yourself that you're not ready to start because there's so many things that you're not factoring into and you're not ready for, like CTMS system. I mean, this is nonsense. Just get started. Get your site, get a doctor. You may not even need a site. You may find a doctor who already has a site, right? Focus on those three things, the core building blocks of any research clinic: PI, studies, patients, right? And then blocking and tackling. What wins games in the NFL? It's the offensive line and the defensive line, and those things are not really that interesting to talk about, but it's what you need to do. And I forgot to add something, Guru Nation. Just got way too hot outside. Couldn't think. It's over 100 degrees today. I'm not saying that owning a clinical research site is easy by any stretch of the imagination, and it's not going to be a place where you can make quick money. It's actually slow money. You have to be extremely patient for it. But if you wait long enough, if you do your blocking and your tackling, if you need me to help you with that, like focus on those three things I mentioned in this video, you're gonna learn. There's a huge learning curve. I'm not trying to say, I'm not oversimplifying this thing at all. You don't want to lose the study once you get it. And that's where it could get complicated. You really need to follow the protocol. You need to pay attention to detail. If you can't do that, you need to hire someone who will be able to do that. That's called a study coordinator. Although I recommend you be the study coordinator if money's an issue, so you could bootstrap it. It's not easy and it's not quick money, but over a long period of time, all right, as long as you focus on the fundamentals and then you train, you can add elements of training and making sure that your staff is actually doing the blocking and tackling, so you can then be focused on recruiting the talent that will work for you, right? Recruiting the study coordinators, recruiting the patient recruiters, recruiting the doctors. Now you're elevating yourself to another level where you're not working in the business, you're working on the business. So not easy, not quick money, but over a long period of time, it's one of the most sustainable businesses you can be in, because you can be a CRA. There's full-time CRAs that own research clinics that make passively $100K a year from their site, and they're not even there but like a couple hours a week. So over a long period of time, it is sustainable if you focus on the fundamentals. And if you don't have the time to do it, you need to hire the people to do it, and then you need to manage the systems. So it can get complicated, but focus on the fundamentals. Those are always simple yet hard to execute. Blocking and tackling, right? Talk to you soon, Guru Nation. Bye-bye.